from breakthrough strategies to game-changing innovations and cultural shifts. You'll discover the lessons that drive real impact, and we'll dive into the moments that changed everything. Welcome to The Missing Piece with April Reed. Today, I'm excited to welcome Shawn Valenta to The Missing Piece. Shawn has spent nearly 25 years in healthcare, beginning his career as a respiratory therapist before moving into clinical leadership, telehealth innovation, and healthcare transformation. Throughout his career, Shawn has helped build and scale programs that expanded access to care across South Carolina and beyond, including statewide telehealth initiatives, rural access programs, virtual emergency care, and correctional healthcare services. His work has centered around solving real healthcare challenges, not just with technology, but with strategy, collaboration, and a deep commitment to reaching patients where they are. Shawn brings a unique perspective as a clinician, operator, innovator, and leader who has seen healthcare evolve from bedside to large-scale digital transformation. Today, we'll talk about his journey, the lessons he has learned building programs from the ground up, the future of healthcare and AI, and what he believes may be the missing piece in creating better access, better outcomes, and better care. Welcome to the show, Shawn. I'm really happy to have you.
Thank you, April. Appreciate you having me on.
I'm excited to jump right in. But first, I just want you to introduce yourself. I know I just did a mini introduction, but how did you get started? How did you even get into healthcare? Take us back to the beginning.
Sure, yeah. And thank you for that great introduction. Because my career has spanned between respiratory, telehealth, and the correctional healthcare. But it all began, I'm a Rust Belt kid. Grew up outside Pittsburgh. My dad was a steel mill worker. I didn't have much exposure to healthcare professionals when I was a child. I had an aunt who was a nurse, but didn't know any doctors or anything like that. So it wasn't until high school I had a very good friend who was in a bad car accident, had a lengthy hospital stay, and then a long-term stay at a long-term rehab. And I started to visit him often. And during that time, I guess because he knew me, he trusted me, he responded to me during physical therapy. And so much so that his parents would often say, "Hey, Shawn, we're going up again this weekend. Would you come with us?" So I started going up a lot, helping with his physical therapy, and so much that his physical therapist started to say, "Hey, Shawn, can you help us with this other patient over here while you're here?" And so I started helping them out, and that evolved to I began volunteering at an outpatient physical therapy clinic when I was in high school, with the thought that was going to be okay. I enjoy this, helping people in healthcare. And so that got me on the track that I was going to do that in college, which eventually evolved into respiratory therapy. I had to pick an undergrad degree. My grandma was my best friend, passed away right before I was going to college, and she passed away of emphysema. So that was like my other connection to healthcare, just seeing her doing her breathing treatments and going through that process and her hospital stays. And so that got me on the respiratory route when I got into college.
It's interesting. I love that because those were like two pivotal moments in your life that kind of illuminated your eyes. It's like, okay, I want to make a difference. I want to make an impact. And unfortunately, two terrible things that kind of opened the door. But when we listen to that intuition and what we're being drawn to, it kind of takes us on this path that we didn't realize had happened. So you become a respiratory therapist. I assume you graduate and you start working for clinics or for hospitals. What's next?
Yeah, so I started working I moved to Greenville, South Carolina, and started working at a level 1 trauma facility in the ER as a respiratory therapist there. And it was a great learning experience for me. I learned more about my passion for healthcare at that point. I felt like I already had it, but like it went on hyperdrive at that point, because now I started being exposed to all these professionals in the real world, which is very different than, when you're actually just going to school for it. So I had a lot of great mentors, both in respiratory and also physician leaders that took me under their wing, because I think I was so inquisitive. I always wanted to learn more. I think they were good with it because they're like, oh, he's asking questions, but he's also retaining the information. And they saw my hunger for wanting to learn more and more. And so, that was a great time for me to really dive into healthcare and start to be exposed, not just to the respiratory world, but I started to get exposed to, broader specialties when I was there as well.
So that leads me to a question I always ask everybody. If there was like a mentor or somebody that in your life that move that needle to kind of push you into more of a leader than you even realized you would be, and how you started getting even pushed to the leadership perspective?
Yeah, it's hard to pinpoint just one because I mean I feel like
Mm,
I had so many. I had this person Georgia White, who was a respiratory therapist, who took me under her wing when I was in Greenville. Scott Kriego was a respiratory educator when I got to MUSC. I think from a administrative standpoint, there was a guy named Michael Ricciardoni, who was an administrator in the radiology department, and I actually was friends with his son. And when I was in MHA school, I had to interview, a leader. So I got connected with him and I learned all this great stuff that he was doing or had done in his career. I was like, man, Michael never mentions any of this. He goes, Michael doesn't know half the stuff I've done. And it was, but he taught me a lot. One of the big things he taught me was, predict and solve problems and you will go far in healthcare. And just meaning like, I remember I told his son that, and Mike was like, what does that even mean? I was like, it means you got to figure out what's coming around the corner.
right,
And
right.
if you can predict those things and mitigate those challenges, then you will be extremely successful and you'll be recognized that, oh, hey, this happened, but we already had a plan put in place. Sean already put a plan in place for that. So that was
Oh.
one of the early, I think, from a administrative leadership roles that really pushed me
I
forward.
love that. I mean, people say solve like the pain points, and you can go anywhere, but the ability to predict kind of what's next and how to become a part of it, which happened for you because you started becoming a part of telehealth when telehealth was even a thing. And so it's like, here you are, this respiratory therapist. Now you're on the complete innovation and revolution of telehealth. Take us on that journey. Tell me more about that.
Yeah, I because I had some success in respiratory, and I developed a lot of strong relationships with physician leaders that really positioned me to become the first director of telehealth at MUSC. So that was back in 2013. And actually, I'm in a unique situation where I've actually never been a manager. I was 2 years an assistant manager and some initiatives that I was leading helped MUSC gain some national recognition with UHC, which is now known as Vizient, which does all the data collection for academic health systems. And we were one of three in the country that improved quality and reduced cost. And I was leading a lot of those initiatives at the forefront of those. And so my name really got put out there. And when I went for the director role, um, it just worked out and it was a blessing. I was hired by our executive medical director, Dr. Jimmy McGilligan. And I remember being in an interview. I'm like, what are we doing? Well, we wasting time. We got work to do. Let's go. They can, he saw the passion, but I was also young.
Mhm.
And at that time, yes, 2013, we'd explained a lot for years what telehealth was. Up until the
Yeah.
pandemic, most people didn't know what it was. But I would say one of the biggest things out of that time, even though I learned so much about technology, clinical delivery, all these different components, probably one of the biggest learning pieces was around listening and building relationships during that time and I
Mm.
had to do that both internally and externally. I had to, even though I was the first director of this department of one, there was other people doing telehealth in different clinics that I had one of my objectives was to kind of bring them together under one umbrella. And so, being the new person, having to listen to them, like, listen, I don't know anything, you guys are the experts, but how can I help you? I'm not here to get in your way. I'm here to help you. And so developing those relationships to move things forward, working with statewide competing hospitals, which helped us create the South Carolina Telehealth Alliance, which is arguably the most successful statewide telehealth collaborative in the country. But there was difficult moments in those early years, and then even also working with rural providers out in South Carolina and listening to them of what their needs were. And it didn't matter what I had to talk about. If it wasn't their priority, that wasn't solving their most major issue. And so I really try to listen to those major issues
Mhm.
because that also helped us in regards to service development. It's like, yeah, hey, we developed this thing, but I'm hearing the big problem is this. We need to create something to solve this. And then that's how we really started getting some early tractions, really trying to understand people's problems and how we can solve them.
What's incredible about what you've been able to do specifically, like you said, not only for the entire state of South Carolina, but I know you guys ended up, all eyes were on you from a United States perspective, is you were handed something and you're like, let's go to work. But you didn't even like have the team or necessarily the know how of what you were about to embark on. And I think it's just really inspiring because as the younger generation who's listening to this or your peers that are listening to this, it's all about like you said, just listening to others, leading, with integrity, and then also maybe not trying to be the smartest person in the room, but you're willing to do whatever it takes to solve the problems or find the
Yeah.
people that can do it. And from there, it sounds like it's just been nothing but uphill for you. It's funny too, because when you said telehealth in 2013, telehealth didn't even really get on the map until COVID. But
Yes.
that's not true. It's been around forever. And so going back to originally your son, like predicting the future and being able to see and get ahead of it is just unbelievable. I mean, you do have to give yourself credit for what you've been exposed to. It's really
Well, I appreciate
remarkable.
that. So, we had a great team during that time frame, and yeah, I mean, and we eventually became in 2017 became a national telehealth center of excellence, which was a HRSA federal designation. So we received a lot of validation for what we were doing. But yeah, it was an exciting time to be a part of. And but even during that time, 2017, I was still going to like family gatherings up in Pittsburgh, and they're like, telehealth, you work with like phones or something. What do you do? It was still unknown. And maybe around
Right.
that time, people started to know a little bit about like Teladoc employee based solutions. And they were
Right.
thinking that's all it was. Like, oh yeah, like I
Yeah.
can call for a pink eye. It's like, yeah, that's one avenue. But to
Yeah.
explain what we were doing in telestroke, tele ICU, school based telehealth, remote patient monitoring, all these other things, were like, oh, I didn't even think that any of that stuff was possible. And so there was this whole other layer that a lot of people just weren't exposed to. They were just used to the virtual urgent, virtual primary care type of model.
Yeah. And we're gonna, I think everything that we're talking about right now really resonates when it comes to AI and the future of AI. We'll talk about that in just a little bit, but take us now on to the next piece of your journey on the correctional side of things. So your career just continues to progress. Tell me, keep taking us on the journey.
Yeah. So late 2020, I got recruited by the largest correctional healthcare company in the country. And I didn't, that wasn't my thought. Like, hey, I'm eventually going to go into corrections or anything.
Yeah.
But even that, I mean, growing up outside Pittsburgh, I had friends that grew up that made some bad decisions and got in the system, and so but have come out and are doing extremely positive things. So I realized that there are people there that have just made some bad decisions. Not all of them; some of them are very bad people, but
Mm.
I knew it was a vulnerable patient population, and there were different things about the model being a lot of full risk contracts. So you're really talking about actual value based care. So a lot of people were talking about value based care and starting to put their toes into it, but this was a lot of that. And so it aligned with a lot of things I was interested in, really redesigning the way care is delivered for a vulnerable patient population and doing it at scale. And so again, I starting over from scratch. This time I was a department of two. There was already one person there. So we already had a significant improvement and we started to build things out. And so one of the first big services we built was a virtual emergency care service, which became the largest ever in corrections. And
Wow.
delivers over 100 consults a day at this point. And that's significant because we were bringing an expertise. It's very similar to the telestroke model. We're bringing an expertise in a time sensitive manner to make a clinical decision of can we treat this patient on site or do they have to go to the ER? And if they have to go to the ER, is there any type of care we can start earlier along the care continuum to help improve their outcome? And by doing that, we were able to significantly reduce low acuity unnecessary transports off site, which is huge from a safety standpoint, not only taking an inmate outside the facility, but also taking understaffed correctional officers outside the facility. We were able to significantly improve access to care. We were bringing in these providers or emergency medicine providers within an average of a couple minutes and keeping the majority of patients safely on site. So it really, like telestroke, changed the standard of care of stroke care in the country. I feel like that service is and will continue to change the standard of care, and triaging emergency care in corrections across the country. It's already in hundreds across the country, jails and prisons, and it just continues to expand. So it's something we were very proud of. And we started to innovate beyond that: virtual nursing, virtual primary care, using tablets getting into housing units, which was the first of its kind. So, yeah, again, a lot of fun building a team, scaling services, and doing what I was doing in telehealth originally at MUSC is what are the major problems? I always try to lead with that of like, what are your major problems? Because typically, if I just said like, hey, I'm trying to do telehealth, people have a preconceived misconception of the small scope of what telehealth is or can be. And when I just opened up, like, just tell me about your major problems. I don't even want to talk about telehealth. And when they did that, then I would start leading into potential clinical solutions of things that I've done in the past. And again, it just opens up their mind of like, oh, wow, I didn't even think that's possible. Because in
Mhm.
all these areas, when I got into stroke, I was not a stroke expert. I was not an emergency care expert. I was not a correctional expert. I was never an expert in any of these things, but I learned how to communicate and ask the appropriate question from the experts to help work with them to create a service that met their needs, that solved their problems. And so that's always fun because there's these time periods you're talking with them and you can see the invisible light bulb go on. It's like, oh, whoa, if we could do that, then we can probably do this,
Mhm.
and I need that, and I feed off that because I don't have their layer of expertise in their specialty, but I've uh, I've had a lot of success of opening up that innovation box for them.
So you just answered a lot of the questions I was going to ask around that because I mean, obviously not everything turns to gold, but because there's going to be challenges, there's going to be bumps along the way, but that was going to be like, what is your advice and that secret sauce to, if you come in as the non-expert, what to do? And you kind of answered it in the sense of like, just ask the experts and ask the right questions. Do you feel like that's most of it? Like just being able to ask the right questions and wanting to solve the problem to get to the next step? Like, I mean, here you have now two massive initiatives that are successful, So it's like everyone wants to know, like, well, what's the one secret sauce? And to somebody who doesn't have to be the expert, you think you're not going to be qualified, but you can be. I don't
Yeah.
know. What is your
Well,
ultimate secret sauce when it
I do
comes to that?
I think there's different components. I think it's asking the right questions, and typically I always look at it as like three main questions. So, what problem are you trying to solve?
Right.
What are the clinical outcomes you're trying to achieve? And then what's the most efficient, effective way to achieve those clinical outcomes? And asking those
Mhm.
three questions, that can typically open the mind up into like design thinking. Not like,
Yeah.
hey, traditionally it took us these 10 steps to do this process. So we think maybe steps 2 and 3, we can use telehealth. Or now it's going to be, we think AI can do
Mhm.
step 5 and 6. It's why are we doing the 10 steps to begin with? And yeah, maybe there's a piece that the telehealth or AI eventually can do, but maybe it can do it completely different. And you don't need those 10 steps. Maybe it only needs to be 3 or 4. And so again, getting into the like what outcomes you trying to achieve, that really just changes the conversation. But then also having the right
Yeah.
structure in place. I saw some top down ideas come through like, hey, we need to develop this telehealth service. And you start to go a little bit away. It's like, well, who's the clinical champion? Wait, does the clinical department's got buy-in on this? And so we
Mhm.
actually started doing like scoring prioritization to ensure all the things that we learned along the way that could be mitigated up front, to ensure that we had the right people there, that the service had a significant impact on either access, quality, or cost that we were going to invest, that it aligned with organizational strategy. Because if it was like it was far off from that, we knew that we weren't going to get the help of cooperating departments like legal and compliance and IT. Like we needed to do stuff that was aligned with them to ensure that we can move forward in a positive way.
Yeah, there's so much. I'm going to definitely listen back to everything that you just said because it's really good even for business owners. Like it's all the same principles. If we just learn the principles, of asking the right questions, solving the problem, making them more efficient and effective, it's amazing how much more we can get done and accomplish. I think we can overcomplicate things very quickly in general.
Yes.
Even the healthcare system as a whole, it's like it becomes overcomplicated and then nothing effective happens operationally. There's too much red
Well,
tape.
yeah, and it's a complicated system, and I think that again, that's probably been one of my strength is figuring out how to simplify that complicated
Mhm.
system. And so that's one of the things I've always tried to do is like, all right, how do we simplify this
Mhm.
in some way? And again, it's not always easy because the system has been set up with misaligned incentives, so that is a difficult piece where it's like, hey, we could improve access to care with this patient population, this is great, but it's like a payer looks at that as, all right, you're going to increase utilization, we're doing fee for service, that's going to cost me more money. No,
Right.
I'm not in on that. And so there's only so much we can do. We can't get to scale if we don't get the payers involved, or if we're doing something that takes too much time for the providers to conduct, it's not improving their workflow, they're not going to get involved at scale. And so thinking about all the stakeholders, the patients, the providers, the payers, the stakeholders involved, and understanding how each service will impact them. Not every service is going to impact everyone positively, but I can guarantee you if it impacts one of them negatively, you better solve for that before implementing, or you will never scale. You'll get to a certain point and you'll wonder why we couldn't get past pilot.
That's really good. So, switching gears and talking about healthcare and AI and technology as a whole, you've been around for a long time. You've seen a lot. I'm sure even going back to your school days where, I don't even know if EHRs were a thing, then, but it's like the evolution of electronic health records, then telehealth. Now AI is all the buzz. I'm just curious your opinion and your take on both past, present, and future, impact of artificial intelligence, and where do you think it will take us, good, bad, and different? Just your
Yeah.
opinion around all of it.
Yeah, no, I'm excited this period of time. Very optimistic. I've always considered myself. I try to be a realistic optimist. And when you think about healthcare in general, we've really been slow to adopt technologies compared to most industries historically. And so
Mhm.
to see recently that we're actually one of the leading sectors in adopting AI, it's very encouraging to see. Now, the challenge with that is it's not necessarily being adopted in a consistent, coordinated way across organizations. You're seeing providers just picking up things themselves and doing different things. And a lot of this is driven by the consumers. I saw recently Nate Gross, who's the VP of Health at OpenAI, say that users are asking 40 million users are asking healthcare questions every day on chat. So we've never had
Wow.
that level of engagement in regards to healthcare. And we got to figure out how do we capitalize off that. And so you're starting to see some good things in regards to like ambient scribe companies who are improving clinical documentation and helping reduce provider burnout. But I would say what I'm most excited about is that next phase of how do we integrate AI into clinical workflows to really reach our patients in a more efficient, effective way from an engagement standpoint and everything from that. But again, it has to be integrated intelligently, not bolted on just to say we do AI. I think I'm seeing a lot of that. Like people are buying something because they feel pressured that, I'm going to miss the boat here. So I got to get
Right.
something. And they're not really being thoughtful about what they purchase and the problem they solve. So I do think if I was an organization leading, I would be thinking, okay, yes, we do need to do something, but let's be thoughtful. Let's start with something that's really solving a problem for our organization or our patient population, and let's be intelligent of how we adopt that and how we train our providers, our teams. I think it's very similar in regards to the EHR adoption period. I was when I first got out, I was on paper, and slowly started to have my stylus with a pad and get through the McKesson and then eventually Epic but it was a struggle for providers for so long, and now they're viewed as so widely successful. But it was a different story at first, and so I think we really should be taking the lessons learned from that time period. That it's not just the technology, and it's not just a strategy of we need to do something.
Right.
There's also a third component. I think of what you do, April, and what you've done for organizations with EHR adoption. I see companies like yourself of saying like, hey, we can actually help you from an AI standpoint to make sure that you are adopting this technology in an intelligent way. Not just like, hey, yeah, you should do it. We're actually going to stand shoulder to shoulder with you and help you with that. I think that's going to be a missing piece that people will need to carry things forward. Some large organizations have the money to invest in it, but there's a lot of, mid-sized, smaller health systems that will struggle without that support of someone who has seen it across the industry and not trying to just figure it out by themselves, but someone that can work alongside them and help them with their own unique local challenges.
Yeah, I love that. You're actually the first person that has answered it in that way from adoption, implementation, training perspective. You're right. There's all these tools, you implement an ambient scribe and you think, oh, it's going to do this, and this for me. Or we implement another tool for the radiology department or for billing or for whatever it is. But if it's not thought of from the implementation, the utilization, the adoption, the customization, and the training to deployment, it's going to be a broken system similar to EHRs. And ironically enough, we actually just recently got an RFP for that. And so there are some that are considering that. But of all the guests that I've interviewed, You're one of the first that said we definitely need to address it head on, similar to the EHR implementation. And I couldn't agree more. So yeah, very interesting.
And I see that, especially during this time of the rural transformation funds over the next 5 years, I think again that will be a need that people are trying to figure out. Like, yes, we know we need to adopt this technology, but we also don't know what we're supposed to be doing. How do we do it? And I think we all know that dropping in technology by itself and just praying that something will go well and it'll just work hasn't been successful in the past. Like, you need those supporting components, both from a people and a process and infrastructure, to ensure that they're successful.
Yeah, that's really good. I agree. So, two more questions. You mentioned the missing piece in regards to like AI and digital transformation and adoption around that. Is there a missing piece moment for you in your life that maybe moved the needle personally, if there's something that resonates, or a moment that changed everything for you that you would say, oh, that was the missing piece that changed it? We've talked a lot about, but I don't know if you have one that comes to mind.
I mean, again, I think I've had a lot. I think mentorship has been a big piece, right? And that's been a huge thing. So it's not been like one thing, but it's been so many people that have helped me get to the next step in my career. I'm now in a point in my career where I actually have more mentees than mentors. And I love that. I
Yeah.
love seeing like some of my people that were coordinators underneath me that are now directors and leading big health systems or different roles and stuff. So that's exciting to see. And yeah, I mean, it just I've been very blessed to have a lot of people that have taken the time to help me get where I'm at. And I think we do need more of that. I do think that is actually, I would say, a missing piece in healthcare right now, because when I got out of school, that person I referenced, Georgia White, who was a very experienced respiratory therapist, took me under her wing. It taught me a lot that you just don't get in school. I mean, you get a foundation in
Mhm.
school, but really that real life experience is, you need the school, but that real life experience just goes so far when you start seeing things in real time. And what I'm seeing now is because of, the baby boomers and what happened with the pandemic and people in early retirement or shifting into other careers, especially in nursing with the national nursing shortage, you're getting nurses that are coming out of college and their most experienced nurse in their unit has been there for 2 years. And so I'm hearing more and more of that it is a significant problem. And I don't think we fully understand the repercussions of that as that continues. People, I think, acutely are seeing that, but I think that's going to have a significant if. And I know there are people that are trying to solve for that. There are people trying to figure out, like, all right, how do we put virtual nursing solutions in play, not just from a virtual nursing from a care delivery, but from a how do we support our young nurses? I've seen some people do some innovative things with that, and I think that is going to be extremely needed to support the next generation of healthcare leaders in some way.
I love that. What's next for you? What next problem, or do you want to solve? Or, do you want to write a book? What's next
Well, I've
for
actually so
Shawn? And
years ago, was it 2021? I actually was a co-author and co-editor of two books, along
fun.
with my friend Dr. D Ford, and we had some other co-authors. One was actually about TSIM, which was the process we used to develop, implement, and operate telehealth services back in MUSC. I'm thinking I'm gonna take a break on writing books anytime soon. So I've been very successful respiratory telehealth and corrections. I've had a lot of fun. I'm at kind of a transition period right now where I'm being very intentional of where can I provide value to the next group? Like, what's the next step in my journey? And I'm looking at opportunities in regards to where can I help grow a company, get them to scale, make them efficient, and build a team. I love building teams. I love creating a culture of accountability around a shared purpose and vision, and getting everyone rowing in the same direction. And that's a big passion of mine. So yeah, to be determined of what comes next.
I love it. I love it. If someone wants to get in touch with you, is LinkedIn ideal? We'll drop your information
Yeah,
on how
absolutely.
people can find you. Okay, that would be awesome. Well, thank you so much for your time and for your wisdom and insight. Like I said, I'm definitely going to go back and listen to this. Even just as an entrepreneur and a business owner, I think there was so much truth. And like to the younger generation or people in the clinical workforce, the inspiration that you are in your story, and knowing you can do anything and you can become anything, and having the courage and the will to do it. not necessarily the background or the degree or, I think we expect too much of ourselves when really, if we just walk through the door, anything could possibly happen. So
For
really
sure.
inspiring. Thank you, Shawn.
Well, thank you, April. I appreciate it. And thanks for having me on.
Of course. Every leader has a story, and every story reveals another piece of the bigger picture. What if the missing piece wasn't something you had to find, but something you were meant to become? Subscribe, share, and keep leading with intention. I'm April Reed, and I'll see you in the next conversation on The Missing Piece.